All right, hey guys, welcome to Chapter 7, EKG Plain and Simple. Today we're going to talk about rhythms that originate from the sinus node. Okay, so if you remember back from anatomy, the sinus node that is located on the base of the heart, which is the top part of the heart, typically on the right atrium in that general area. Sinus rhythms, anytime you hear the word sinus rhythm, we're talking about a rhythm that originates in the sinus node. The sinus node is the predominantly more popular node. That is the one that typically functions and helps the body do what it needs to do, and the heart does what it needs to do. It's all based on what the sinus node tells it to do. When the sinus node fires electricity, the electrical impulse fires, it travels through the atrial. It depolarizes the atrium. The top part of the heart then contracts. After it contracts, of course, it's going to squeeze the blood down to the ventricles. As it's doing that, then the electrical impulse then will go down through the center of the heart, through the pathways. It goes down to the ventricles, and then once it gets to the ventricles, it spreads out through the bundle of his and goes to the left and the right side of the ventricles, and then the ventricles then contract. This does take just a little bit of time to go from the top part of the heart to the bottom part of the heart. If you remember your PR intervals that we were measuring, the P to R interval, the point 12 to point 20, that's how long it takes the impulse to go from the atrium to the ventricles. So point 12 to point 20 of a second is what we're talking about, how long it takes the electrical impulse to go from the top part of the heart to the bottom part of the heart. And then the contraction of the heart, your atrium is going to contract, and then 0.12 to 0.20 of a second later, the ventricle should contract after that. So the sinus node is the pacemaker that's always in control. Assuming that the heart is okay, it's healthy, they don't have any problems, you don't have anything going on, a normal, healthy heart with everything working like it's supposed to, the sinus node is the heart's pacemaker and it is who is in control. If there's any type of illness related to the sinus node or death to the sinus node, then one of the lower pacemakers take over, and these are called escape beats. When the lower pacemakers take over, there's a couple other ones there in the heart. When they take over, the QRS complexes and the rhythm's going to look different, and that way we can tell which node it's coming from. That's why earlier, the last chapter was talking about identifying the P waves, identifying if there are more than P waves, looking at the QRSs, measuring the QRSs, and so forth. All that data and all that information tells us where that impulse came from. And if it meets all the criteria to be normal, then we can assume that the impulse is originating from the sinus node. Typical rate of a sinus rhythm is going to be anywhere from 60 to 100. That is the normal rate for the typical person. Also, though, when you're looking at the rates, take into consideration the patient. A very healthy, athletic, young individual is going to have a slow heart rate, so his normal rate may be in the 40s or the 50s even. Whereas a smaller, chronically ill patient may have a normal heart rate of 110 to 120, and that might be normal for them also. So take into consideration when you're looking at the heart rate, kind of look at the patient too, and the overall general health of the patient. But as by definition and by textbook, a normal rate should be 60 to 100. If the heart rate is too fast or too slow, this causes a decrease in cardiac output. That decrease in cardiac output then will translate over to a problem with the blood pressures usually. If the heart rate is really, really slow, the heart's not squeezing fast enough, it's not producing enough pressure to help circulate the blood, so therefore the blood pressure is going to drop. And just the opposite, the heart's beating too fast and it's contracting before it gets a chance to fill back up, it's not going to be able to move the right amount of volume of blood, and then the blood pressure then will drop. This is what they call symptomatic. You'll hear people say that, they had a heart rate of 50, but they were or were not symptomatic. That's what they're talking about. Is if the blood pressure or other signs of the patient, if there was something wrong with the patient, or if the patient just had an abnormal heart rate. Sinus rhythms are the standard against which all other rhythms are compared. So every other rhythm that you look at, if it's not a sinus rhythm, it's not normal. This is the kind of way that they look at it, and everything is compared to a sinus rhythm. So criteria for a sinus rhythm. If it is a sinus rhythm, this is kind of like what we went over earlier in the chapter, to make it a normal rhythm, all the P waves must be upright. All the P waves must match each other. When you're looking at lead 2, all the P waves must be followed by a QRS complex. Right? So you should have a PQRS, right? If you have more P's or more QRSs, this is not going to be a sinus rhythm. Your PR intervals should be consistent, right? Meaning that the distance between your P to R interval should always be the same amount of space. The heart rate has to be equal to or less than 160. If the heart rate gets above 160, then it's not going to be considered a sinus rhythm. It gets classified as something different. All matching upright P waves in lead 2 are considered sinus P waves until proven otherwise. Right, so when we're looking at this, we're looking at the P waves, we're looking at the complexes. It's a P wave until proven otherwise, just like it's a normal rhythm until proven otherwise, right? So all the P waves in lead number 2, they're always going to, if they're consistent and they look like P waves, we're going to call them a P wave unless we prove it to be something different. So what's happening here? So the sinus node is right up here. It's right in this little top corner. Right, so he produces a little electrical impulse. The impulse comes down. As soon as it comes down, it comes from the sinus node. It goes over to the atrium, left and right atrium. It stimulates them. They depolarize. They contract. When they contract, it physically pushes the blood down to the ventricles. As it does that, then the electrical impulse comes down. After it gets done with the atrium, you will see that on the EKG as a P wave. Once that happens, then the electrical impulse is going to come down to the AV node, which is this little guy right here. It's going to go through the AV node. Once it gets through that, it'll branch off. It goes down to the left and the right sides. These go down to the ventricles. When it goes to the ventricles, then it will depolarize the ventricles, causing the ventricles to contract. When each one contracts, then it expels the blood, and the blood goes to where it needs to be. When the ventricles contract, that causes that QRS complex. So P wave is when the electrical impulses is in the atrium. The QRS is when the electrical impulses are in the ventricles. So this would be a normal rhythm. Sinus node fires, goes to the atrium, produces a P wave, goes to the AV node, carries on down to the ventricles, causes a QRS complex. And this happens very, very quickly. Right? Remember, your QRS is 0.12, your PR interval is 12 to 20, so we're talking less than half of a second. A normal rhythm, this should all take place and be done from start to finish in about 0.3, 0.32, something like that, of a second, about a third of a second. Sinus rhythm is the normal rhythm. Impulse starts from the sinus node, travels through the atrium down through the ventricles. Every P is married to a QRS, and the heart rate is 60 to 100. Right? This is one of the ones you got to remember, 60 to 100. You will see that several times everywhere. 60 to 100 is the normal adult heart rate. Again, 60 to 100, normal adult heart rate. For a sinus rhythm, 60 to 100, it's got to be regular. The P waves got to be upright. They got to be matching, and they got to be married to a QRS. The P to R intervals should be 0.12 to 0.20 and consistent. Stress the word consistent here. The distance needs to be consistently the same distance on every PR interval. QRSs less than 12. This is a normal rhythm, so there is no underlying cause that will cause this. There is no adverse effects because this is what it's supposed to be doing. And there is no treatment based on this criteria of what you see here. They would not treat any of this because this is a normal rhythm. This is where everybody should be. So, looking at this little rhythm, what do we got? Let's break this down a little bit. Right? We have a QRS. Right? We have QRSs for each little beat. We have a P wave. Each little QRS has a P wave. The P waves are all upright. They all look the same. They're all uniformed. The spaces between each QRS looks to be really, really close to the same. Here's where your measurements come in. Right? If you look at it really, really close, we're going to do the P to R intervals. Right? If you measure this out from here to there, right? This looks like a little bit longer. I'm going to say that's right at about a 0.2, maybe a little bit more, right? So this is one of the ones that you definitely want to measure that out, because if it is greater than 0.2, that is a significant finding, and that's going to put it into a different category. So make sure you measure that out. Also measure the QRS. The QRS looks like it's going to be about 2 boxes, looks like here. So that's probably going to be about 0.8 or so for the QRS. So the QRS is going to be within that 0.12 range. I would measure out, though, your P to R interval here. If it's in range, it's right on the mark, right on the 0.2. So, what do we call a slow heart rate? If the rate is below 60, remember it said the normal rate is 60 to 100. If the rate is below 60, that is what they call a sinus, because we have the P waves, sinus Brady, B-R-A-D-Y, bradycardic. Anytime you see the word Brady, B-R-A-D-Y, that means slow. Right? You see that several times in different medical terminologies and referring to different things. But if you see the word Brady, it's slow. So sinus bradycardia, C-A-R-D-I-A, means a slow heart rate. That means any rate less than 60. Slower than normal rhythm from the sinus node. Impulse originates from the sinus node, travels to the conduction system normally. Everything's flowing like it's supposed to. The conduction is not an issue. It's just for whatever reason, the sinus node is sending out impulses at less than 60 beats a minute. The QRS complex can be positive, negative, or isoelectric, depending on the lead beginning. So everything else is going to look normal. Everything is going to look like it should. It's just a slow rate, something less than 60. So that is going to be a sinus Brady rhythm. Again, rates less than 60, it's going to be regular. P waves upright. Causes of a sinus Brady rhythm, vagal stimulation. This is, if you guys remember when we were in class and we checked your pulse and everybody held your breath and your heart rate dropped, that is a vagal stimulation. Right, you stimulate the vagus nerve, which sits behind the epiglottis there in the back of your throat. If you stimulate that, that will cause your heart rate to drop down a little bit. MI stands for myocardial infarction. This is what people refer to as a heart attack. That will cause sinus bradycardia sometimes. Hypoxia, H-Y-P-O, is low, and then the XIA is oxygen. So anytime you got low oxygen, that could potentially cause a slow heart rate. Digitalis toxicity. This is a medication that people take to control their heart rate. It specifically is intended to slow the heart rate down. So if you overdose or take too much of it, or it builds up too much in your system, that will make your heart rate drop well. And the last one is well-trained athletes. Somebody who's very physically fit, the body doesn't really need a fast heart rate because the heart muscle is very efficient at this point because you've worked out so much. So you may get a normal heart rate, but it just be slow. Adverse effects. Too slow heart rate can cause signs of decreased cardiac output. Decreased cardiac output being like altered mental status, low oxygen, low blood pressure, just overall generally sick people. So if it gets too slow for someone who's not normally slow, it can be a significant problem, and they would have to treat that with medications. For the sinus brady, your PR intervals are going to be 0.12 to 0.20. They're going to be consistent. The QRSs are going to be 0.12 or less. Treatment for sinus bradycardia, there is no treatment unless the patient is symptomatic. Right, this is the big one. You can have a slow heart rate and not have symptoms. Everybody's okay. You have slow heart rate and start having symptoms, then they're going to start giving you some treatments for it. The number one first-line treatment for a symptomatic bradycardic patient is atropine. Atropine is a medication that works directly on the sinus node. It will stimulate the sinus node and make it beat faster, and specifically on the sinus node. So it has to be a sinus rhythm on this. Also, oxygen, if they're symptomatic and they're a little sick and their O2 is dropping, you want to give them some oxygen to make sure that they're getting O2 to all their blood cells and make sure their body's perfusing like it should be. Here's a typical rhythm of a sinus bradycardic patient. We have a rate of 1, 2, 3, 4, 5. I have a rate of 6 here, but if you count this last little guy, he's right at the end, so you don't get the full one in there. So technically, he's probably like a rate of 58 or 56 or something like that. So anything less than 60s, we have full complexes, right? We have 1, 2, 3, 4, 5 full QRS complexes, and then this one here, he's cut off a little bit. There should be a T wave right here. So he's cut off a little bit, so he's not complete, and that's why they're calling this a bradycardic rhythm. We do have P's for every QRS. The distance between the P and QRSs are kind of short, so that's good. QRSs don't look really wide. You have a T wave. Everything else looks good. So this is a normal rhythm. Everything looks good except for he is bradycardic because he has a rate of less than 60 on this. All right, just the opposite, sinus tach, T-A-C-H-Y. Tachy is anything fast, right? So sinus tachycardia, which means that this is originating from the sinus node, it's going to have a rate greater than 100. Rhythms which the sinus node fires at a heart rate faster than normal. Impulses originate from the sinus node, travels the conduction system like normally. All your QRSs are going to look normal. Rate is going to be from 101 to 160. If it gets above 160, it's going to be considered something, it goes into a different category. But 101 to 160, it's going to be regular, now smooth, steady rate. The P waves are going to be all upright. They're going to be matching the QRSs. Some causes that causes sinus tachycardia. Atropine. Remember, the sinus bradycardia, atropine is the first drug of choice to raise the heart rate. The tachycardia, that is a cause. If we give them too much atropine, they'll be tachycardic. Some other medications will also make them tachycardic. Hypoxia again. We talked about earlier the sinus bradycardic would be hypoxia, while sinus tachycardic could also be caused by hypoxia. So lack of oxygen there. Emotions, stress, right? They get overworked or stressful. That can make your heart rate go fast. Pulmonary embolisms. This is what they call PEs. This is where something gets into the lung and blocks the blood flow to the lung. Again, myocardial infarctions, aka heart attack. CHF, which is congestive heart failure. This is where part of the heart muscle is actually dying and failing. Fever, really common cause for a fast heart rate is a fever, especially in children. You get a kid whose normal heart rate should be 140 and they're running 180, 190. That's because of the fever. Same thing on adults. Adults, a lot of times they'll come to the ER of chest pain because they feel like their heart's racing, and it really is. Their heart's running 120s or 130s, but it's because they have a temperature of 102. Right? So fever will make the heart beat fast. Vagus nerve inhibitors. Right? Remember, I said the vagus nerve is what slows your heart rate down. Anything that would inhibit the vagus nerve, that would make your heart rate come back up. PR intervals, 0.12 to 0.20. QRS is going to be less than 12, like normal. Adverse effects of a fast heart rate. decreased cardiac output because the heart's not being able to fill back up every time it beats, and it's not circulating as much blood like it should be. This can cause a myocardial ischemia if the heart rate is too fast for too long a time. If the heart rate is really fast for a prolonged amount of time and there's a decrease in cardiac output for an extended amount of time, it can cause myocardial ischemia, which is an MI. So it can cause what people call a heart attack. So you get somebody who has a really fast heart rate, they're not perfusing very well, they don't have a good blood pressure, they're symptomatic, and if this continues for a significant amount of time and it doesn't get treated, the heart itself, the heart muscle, can suffer from that and not get enough oxygen, enough blood circulating to it, and it could lead to them having a heart attack, an MI, myocardial infarction. Treatment for it, you treat the cause of the fast heart rate. Consider beta blockers and oxygen. Beta blockers is going to slow down that sodium-potassium pump, that's what I was talking about earlier in the impulses. It's going to help slow down the heart rate and help regulate the heart rate a little bit better for you. So here is a rhythm. We've got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. I count 12 beats. So we got a heart rate of 120. We do have a P for every QRS. These P waves, the P's and the T's look very similar here, especially like this one right here, the P wave and T wave, they look very similar there. Be aware though that they're not the same, right? So this is a P wave, this is your QRS right here, and then this is your T wave that follows it. Right? If you have a QRS followed by a little hump, more than likely that's going to be a T wave, right? So don't misinterpret these T waves and call them P waves, right? This is actually the end. This is the end of one complex right here. This is the start of the complex right there, and then this is the start of the next one that comes over to here, right? So don't get those confused. Make sure that you can tell the difference between a P wave and a T wave. When you're looking at this, if you look at them, look at the whole strip all the way across, you can kind of see a little bit differences. The P waves are a little shorter than the T waves on this rhythm, so you can kind of tell who's who. But just make sure you don't get the P's and the T's mixed up on rhythms like this. Okay, so sinus arrhythmias. Anytime you hear the term sinus arrhythmia, we're talking about a irregular rhythm that originates from the sinus node. Has to come from the sinus node. It follows kind of a cycle motion. Usually correlates with breathing patterns. You'll see it. Everything looks normal. The P waves, the QRSs, everything looks like it's supposed to. It's just the rate. The rate will speed up a little bit, slow down a little bit, speed up a little bit, slow down a little bit. It's just a irregular rate of it. It's just kind of, you're looking at it like, yeah, they got P's, they got QRSs, they got T waves. Everything looks like it's supposed to. It's just the rate varies. This usually correlates with the breathing pattern. This is a normal thing. You see it really predominantly in children. Kids will have this problem quite often. With the sinus arrhythmias, a lot of times this is not a really big problem to treat. Usually they don't treat it at all. Like I said, again, associates it with people who breathe. If you watch your own heart rate, it actually does that too. When you take a deep breath in, you'll speed up a little bit, and breathe out, it goes down a little bit. Very prominent in children, though. You'll see that a lot of times in kids. A kid will come in, 6-7-year-old kid or whatever, and you'll be doing an EKG, and you'll hook them up to the monitor. And as you got them to the monitor, you look at the heart rate, and the heart rate may vary 10, 15 points, and the kid's sitting there, not anything wrong with them at all. But as they breathe, their heart rate will vary back and forth. Typically, the rate again varies with the respiratory pattern. It's a little irregular because it kind of, like I said, varies with the respiratory. Depends on how they're breathing. Your P waves are going to be all upright. They're going to be matched, and they're going to be married to every QRS. The PR interval is going to be the same. The QRS complexes are going to be 0.12 like normal. The cause of this is some of the heart disease, breathing patterns, It's very common during sleeping. You'll see this a lot of times when people are asleep. Uh, Adverse effects, there's usually none directly associated with this. Like I said, it's not a big deal. It may be something that you see, just something like an anomaly that you catch, but there's not really a whole lot that they're really going to do specifically about this. Usually, there's no treatment required for this. Here's a little sinus arrhythmia. As you're looking at it, see they've got normal patterns here, kind of a normal space, and then right here at the end it gets kind of wide, widens up a little bit here. Still normal QRSs. Nothing's really changed. It's just the distance between the QRSs, the distance increased just a little bit here. That is probably associated with their breathing. Again, it's something that if you're doing analyzing an EKG and you're filling out paperwork, you may want to make a note of that there was just a slight variation in the rate, but typically they don't do anything for this, and it's not really a treatable issue. Sinus arrest. Sounds kind of bad. Anytime they use the word arrest associated with the heart, right? Sinus arrest is a pause that occurs when a regularly firing sinus node suddenly stops firing for a brief period. Okay, this is when the sinus node is firing like it's supposed to, and then for whatever the reason, out of the blue, it just quits for a second, and then it'll come back. One or more P, QRS, T sequences will be missed. This is, you have your P, QRS, and T, and then you'll be putting along like normal, and then all of a sudden, poof, it stops for a second or two, and it comes back. With this, you may get an escape beat from the lower pacemaker, may take over. Your QRS complexes will be always positive, negative, or depending on whatever the normal monitor would be. So with a sinus arrest, the rate can occur at any time. It can be, it can vary. It is regular except for that interruption, and then after the interruption, it goes back. Pause is not a multiple R intervals. The PR intervals is 0.12 to 0.20 before the pause, and then same after the pause. I'm sorry, same or different after the pause. So you'll have a normal PR interval like you should. You'll have the pause, and then after the pause, you may or may not have the normal PR interval back. QRSs, they're going to be less than 12 seconds on a sinus beat, may be greater than 12 seconds if the ventricular pacemaker takes over. You'll see here in the rhythm just a second. P waves, normal before the pause. The P waves may be a little different after the pause. Cause of this, sinus node ischemia, hypoxia, DIG toxicity, different medications are cause of this. Treatment for it, adverse effects is the decreased cardiac output because the heart's not beating, so you're going to have a very decreased cardiac output. Treatment for it, atropine, oxygen, hold any bradycardia-inducing medications, right? They may adjust their medications. Atropine, again, trying to speed up the heart rate. And here's what it's going to look like. If you're in the room with your patient and this is the first time you've ever seen it, it may be a little unsettling to see this because the heart is going to be just putting along like normal, beep, 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 and then stops. So what's happening here? So we have a normal sinus rhythm, right? We're going along like we should. Sinus beat, sinus beat, sinus beat. Up until this point here, everything is good. The heart's beating like it's supposed to. Everybody's good. Then from here to here, the heart literally stops. It's not beating. It's not circulating blood. Not doing anything. Well, after it stops, like I said, the heart has two fail-safe mechanisms to make the heart beat, right? So once it determines it stops, this is how long it takes, like this particular one, this is how long it took the heart to realize that the sinus node had stopped beating. So then you have a ventricular node, something lower down in the heart kicks in, and this is the backup generator, right? This is the fail-safe. So this backup beat kicks in to make the ventricles contract, right? If there is no P wave here, there's no P wave, which should have been right here. So this came from the bottom part of the heart, just the bottom portion of the heart, not the top portion, just the bottom portion contracts. The ventricles contract. It circulates a little blood, just to keep your body alive, to keep everything going, hoping that the heart will pick back up. And so in this case, this had a little pause. The ventricle picked in, it made its first little beat, and then after it did, then the sinus node said, oh, wait a minute, I'm supposed to be doing something. And then the sinus node picked back up and started firing again like normal. So this would be a sinus pause or sinus arrest with a PVC or a premature ventricular beat in there. So that would be a sinus arrest. All right, sinus block, also called sinus exit block. Right, so a sinus block is a pause that occurs when the sinus node fires its impulses on time. The sinus node is doing what it's supposed to do. It's firing like it's supposed to do. But the impulses exit from the sinus node to the atrial tissue is blocked. Right, for some reason it fires like it's supposed to, but the impulse doesn't actually make it to the atrial like it's supposed to. The beat that the sinus node wanted to make is not conducted anywhere. So it's just kind of fired and didn't do anything. The pause will be at a multiple or previous R-to-R intervals. The QRS complex will be positive, negative, or isoelectric depending on what lead you're looking at. With a sinus block, the rate can be any rate, it just depends on what's going on with it. It will be regular up until the interruption, and then at the interruption it will be paused. The pause is a multiple R-to-R intervals, right? So the pause lasts longer than what one beat should be. So when you're measuring it out, you're like, there's a big long gap in here, and then you're measuring out your spaces, and you're like, well, there should have been a QRS here, there should have been another QRS here, there should have been another QRS here, and then your rhythm starts back up, right? So that would be a sinus block, where you have multiple QRSs that are mixed. QRS complexes, when you do have them, are going to be normal. Cause of this could be medications, hypoxia, vagal stimulation, something like that. In a sinus block, your P wave is going to be upright. They're going to be married to your QRSs. Your PR is going to be 12 to 20 like normal. Adverse effects, decreased cardiac output. That's a very common adverse effect of a lot of heart rhythms you'll see. Decreased cardiac output. You would treat this with atropine, trying to speed up the heart rate, oxygen, and then hold any bradycardic or bradycardia inducing medications. Sinus block. Right, so we got a beat. We got a beat. Should have had a beat. Should have had a beat. Should have had a beat. Got a beat. Right. So we had 2 or 3 blocks in here, 2 or 3 beats in here that we missed a couple of beats. Very, very, very similar to a sinus block and a sinus pause, like what we talked about earlier. Very similar. The block typically refers to one that lasts longer than what one beat should be, whereas a pause would be just for one beat. But you hear the sinus block and a sinus arrest, you'll hear both of those used interchangeably quite often, because it depends on the length of that little blockage in there. So that is all of this chapter. If you look in your book, guys, on page 82, starting on 82, you should have a bunch of rhythm strips that's like this. And there's 82, 3, 4. There's like 4 or 5 pages of them there. This is your homework assignment for the week. When you get to these rhythm strips, get you a sheet of paper, write it in your book, whichever one you want to do. You can put it on a separate sheet of paper. QRS complexes, how many QRSs you've got. Like this one would be 1, 2, 3, 4, 5, right? So QRS complexes, 5. Next, regular. Measure out the QRS complexes. Are they regular in rate? This looks to be regular, so it'll be yes. Heart rate. Count the rate. 1, 2, 3, 4, 5. I see 5 complexes, so I'm going to say a heart rate of 50. P waves. Is there a P wave for every QRS? I do see P waves for every QRS, right? So it's going to be yes. And then you can count your p-waves out. 1, 2, 3, 4, 5. I see 5 p-waves. And you can say, for p-waves, you can say 1 p-wave for every QRS. And then measure out your P to R interval. This is where you will need your calipers on the book. Measure out your P to R interval. That'll be a number. Measure your QRS interval. That'll be a number. And then give me your interpretation. A little bit of cheat on this. It will be a sinus type rhythm, right? Because these are sinus rhythms, right? So everything's going to be a sinus something, right? So it's going to be a normal sinus, sinus tach, sinus Brady with a PVC, sinus Brady with an entopic beat, something like that, right? So what do you see? If it's a normal rhythm, tell me that. If you see something ectopic, then tell me what you've got there. Like this one, what happened here? See, has a little bit of curvature up. Tell me what's going on there. If you look at this one, this looks kind of straightforward. That one, this one, right? Tell me what this here is, and that will be in your interpretation. This guy, this guy, this guy, this guy. Right, so you're just going to kind of go through the rhythms, look through them, identify them, fill out this little section, right? Give me your interpretation, and that will be your homework assignment for next week. And then when we return to class, you're going to bring this homework assignment and your previous homework assignment from last class. Bring those back to class with you, and then we'll go over everything. Alrighty? Any questions, you guys are welcome to email me, shoot me a text, give me a call, whatever you need. If you need any help with something, if you got one that you're looking at it and you just can't figure out what it is, just shoot me over a message, let me know, and I'll take a look at it and try to help you, walk you through it. But otherwise, though, I will see you guys in class. Take care.